Hello friends, today we will be discussing a very small talk article, Incision over the anterior abdominal wall. This talk article is important from part 1 MRCOG, part 2 as well as part 3 MRCOG point of view. It is also important for MS candidates because there can be a full question or short note on the same topic, that is incision over the anterior abdominal wall, where we need to describe various transverse and vertical incision as well as oblique incisions. Okay, for part 1 and part 2 this can be a single based answer question where the name of the incision will be given and various options for the correct description, how many centimeters above the pubic symphysis, etc., what is the length, whether it is transverse, curved, how it is open, that kind of various options will be given and you need to select a appropriate answer. So please pay attention to the proper description of each incision. So we start with today's topic of incision over the anterior abdominal wall. Okay, so when we are performing an incision over the anterior abdominal wall, so what are the factors which we need to take into account? The surgeon must need to think about the underlying pathology for which the surgery is planned, then the possibility of adhesions or malignancy and comorbidities are need to be taken into account. What is the role of skin preparation? The incidence of significant wound infection is less than 5% for all abdominal operations and is related to the patient and surgical factors. Here the figure of less than 5%, one should remember this can be a numerical SBA. Okay, so significant wound infection rate is less than 5% for all abdominal operation. Okay, and the factors may be related to the patient or maybe surgical related factors. Preoperative showering with antiseptic reduces the infection rate in clean wounds. It is 1.3% with preoperative showering. Without preoperative showering, it is 2.3%. Wound infection rates for deep pylori preparation versus no hair removal are equal, that is 0.6%. Okay, the reason for hair removal is to prevent interference with the wound approximation in certain incisions. Now we'll see various types of incision. Okay, so this figure shows a midline incision, transverse incision. Okay, so abdominal incisions, when we are performing an abdominal incision, it should not be made with monopolar electrosurgical device. The same scalpel which is used for superficial incision can also be used for the deep incisions. Okay, abdominal incisions are traditionally divided into transverse incision or vertical incisions. Okay, so what are the advantages and disadvantages of each? So we'll see the advantages and disadvantages of vertical incision. Vertical incision advantage is that it gives an excellent exposure. The main important thing is extensibility of this particular incision. The median incision is least hemorrhagic. There is a minimum nerve damage and there is a rapid entry into the abdomen and pelvis with median incision. Disadvantage is that wound dehiscence and hernia may be more frequent. There are poorer cosmetic results and higher infection rates. Hemorrhage and operative time may be more with the paramedian incision. Okay, now let's see about the advantages and disadvantages of transverse incision. Advantage of the transverse incision is that it gives best cosmetic result, it is less painful, less interference with the preoperative respirations and greater strength. Disadvantage is that it is more time consuming, more hemorrhagic, compromise ability to explore the upper abdominal cavity, and division of multiple layers of fascia and muscles and nerves may result in potential spaces with hematoma or seroma. Okay, again these advantages and disadvantages there can be asked in the SBA, that is single based answer question. Advantage of either vertical or transverse incision can be asked, so these particular tables are important. Okay, now we will see various transverse incision one by one. The first is a phalansteal incision. It is introduced by Phalansteal in 1900. This is a curved incision. Please pay attention to the description of each incision. It is a curved incision approximately 10 to 15 centimeter long, 2 centimeter above the pubic symphysis. The skin and rectus sheath are opened transversely using sharp dissection. Here there is a sharp dissection. Rectus muscles are not cut and fascia is dissected along the rectus muscle. Okay, so this is a curved incision, 10 to 15 centimeter long, 2 2 cm above the pubic symphysis. Skin and rectus sheath are open transversely using sharp dissection. The sharp dissection is performed in financial incision. Rectus muscle are not cut. The rectus muscles will be cut in myloid incision. We will see in further in the slides. The fascia is dissected along the rectus muscles. Okay. Next transverse incision is a Kushner's incision. Here in this figure you can see various types of transverse incision, out of which the financial incision we have just seen, then Joel Cohen incision we are going to see, myloid incision also we are going to discuss, Cherney's incision also we are going to discuss. So there is another also called as modified financial incision, that is Kushner's incision. It involves slightly curved incision beginning below the level of the anterior superior iliac spine and extending just below the pubic hairline. The superficial branches of the inferior epigastric artery or vein may be encountered in the fat. This incision is more time consuming and extensibility is limited. Generally, transverse incision have this particular issue of extensibility. Okay. Next transverse incision is a Cherney's incision. The Cherney's incision involves transection of the rectus muscle and their insertion on the pubic symphysis and retraction cephalad to improve the exposure. So in Cherney's incision, the rectus muscle is transected at pubic symphysis and it is retracted cephalad. This incision is primarily used for urinary incontinence procedures to access the space of Ritzius and to gain exposure to the pelvic side wall for hypogastric artery ligation. So remember, you may be asked about the incision and in which operative this incision is preferred. So this Cherney's incision is used for urinary incontinence procedure to access the space of the Ritzius and gain exposure to the pelvic side wall for hypogastric artery ligation. And what is the peculiarity? It involves the transection of the rectus muscle at the insertion of the pubic symphysis and retraction cephalad. Okay. The next transverse incision is a myloid incision. Myloid incision is a muscle cutting incision. Remember M for M. In myloids, M muscle is cut. Okay. While in Cherney's, the muscle is transected at the pubic symphysis and it is retracted cephalad. Okay. Now this incision involves all layers of the lower abdominal wall are incised transversely approximately 3 to 8 cm above the pubic symphysis. So this incision is around 3 to 8 cm above the pubic symphysis depending upon the patient's habitus and indication of the surgery. The fascia is not dissected free of the rectus muscle. The peritoneum is usually entered in transverse fashion. In a patient with clinical evidence of impaired circulation in the lower extremity, a midline incision should be preferred to the myloid incision in view of the risk of lower extremity ischemia secondary to the inferior epigastric artery ligation. Okay, so as far as myloid incision is concerned, we should remember it's a muscle cutting incision 3 to 8 cm above the pubic symphysis and the fascia is not dissected free of the rectus muscle. Okay. The next incision, transverse incision, is a Joel Cohen incision. Professor Joel Cohen introduced this incision for abdominal hysterectomy in 1954. Okay, obstetricians have used this incision to perform cesarean section. This is a straight transverse incision. Okay, we have seen financial incision, it is a curved incision. Here it is a straight transverse incision through the skin 3 cm below the level of the anterior superior iliac spine and it is higher than the financial incision. Okay, so this particular difference we should remember. One, it is a straight transverse incision and it is 3 cm below the level of the anterior superior iliac spine and it is higher than the financial incision. We can see here in the figure Joel Cohen incision is higher than the financial incision. Okay, so this particular description of each incision you should be able to remember and identify the correct option in the single based answer question. The subcutaneous tissues and fascia are open in the midline and extended laterally with a blunt dissection. Okay, in Joel Cohen incision it is a blunt dissection for lateral extension of the fascia. Okay, blunt dissection is used to separate the rectus muscles vertically and then open the peritoneum. So these are few differences between the Joel Cohen and the financial incision. The last transverse incision is a Marshall incision. The Marshall incision runs at the upper limit of the pubic hair and is thus lower than the myloid incision. The muscles are divided above the opening of the inguinal canal. Okay. Now we go ahead with the vertical incision. Here figure shows various types of vertical incisions, but we will discuss mainly two incisions, that is median or the midline incision and the paramedian incision. Okay, most common is a midline or median incision. The midline incision is the most versatile incision as it can be easily extended. Okay, so ability to extend the incision is one of the advantage of the midline or the median incision. The pyramidalis muscle can be used as a landmark to identify the midline. Coming to the paramedian incision, this paramedian incision offers the advantage of extensibility, especially on the side of the pelvis where the incision has been made. There is no difference in the wound infection, dehiscence or respiratory problems with midline or paramedian incisions. So paramedian incision also has got a same advantage of extensibility. Okay, especially when you have a pathology which is more on one side. Say for example, an ovarian tumor occupying one side of the abdomen. So the paramedian incision may be more useful than the midline incision. Okay. Now coming to the oblique incision. Oblique incisions can be used for transperitoneal or extraperitoneal approach to the abdominal surgery and includes two incisions, gridiron, that is muscle splitting incision of McBurney, and the Rocky Davis or Iliad incision. Okay, the gridiron incision is a downward and inward incision from the McBurney's point. The incision is carried through the skin and subcutaneous fat to the abdominal muscles, which split along the direction of the fiber. The peritoneum may then be reflected away from the abdominal wall inferiorly. This allows the extraperitoneal drainage of abscess, avoiding peritoneal contamination. The gridiron incision can be performed on the left lower quadrant to drain the abscess on the left side of the pelvis and can be varied for appendectomy in pregnant women. Okay, now we'll see the figure of this gridiron incision. It is an oblique incision at the junction of the medial 2/3 and lateral 1/3 of the line joining the umbilicus and the anterior superior iliac spine as shown in the figure 2. Okay, so figure 1 also shows the same incision along with the Rocky Davis incision. Rocky Davis incision is a transverse incision at the junction of the middle and lower thirds of the line joining the anterior superior iliac spine, while the gridiron incision is an oblique incision on the same point. Okay. Now let's see about the principles of suturing the skin incisions. What are the principles? The primary function of the suture is to maintain the tissue approximation during the healing. Debridement of the skin edges can be performed if required. Avoidance of direct tissue trauma helps to ensure the best outcome. Clean passage of the needle following the arc is imperative. Skin sutures that blanch the underlying skin are too tight. Skin edges must touch each other. So these are the some principles for suturing the skin incisions. Okay, so these are few of the points. One is the correct description of each incision you should know. Okay, and they can be asked as a SBA. That finishes today's topic. Thank you.